Chapter 7: Excitation of skeletal muscle, neuromuscular transmission, and excitation contraction coupling. Neuromuscular joints and transmission of impulses from nerve endings to skeletal muscle fibers. Skeletal muscle fibers are innervated by large myelin nerve fibers that originate from large neuromotor neurons in the anterior horns of the spinal cord. As discussed in Chapter 6, each nerve fiber, after entering the muscle belly, normally branches and stimulates from the tree to several hundred skeletal muscle fibers. Each nerve endings make a junction called the neuromuscular junction with the muscle fiber near its midpoint. The action potential initiated in the muscle fiber by the nerve signals travels in both directions toward the muscle fiber ends. With the exception of about 2% of the muscle fibers, there is only one such junction per muscle fiber. Psychologic anatomy of the neuromuscular junction, the motor and plate. Figure 7 1a and b shows the neuromuscular junction from a large myelinated nerve fiber to a skeletal muscle fiber. The nerve fiber from a complex of branching nerves terminals that invaginate in the surface of the muscle fiber but lie outside the muscle fiber plasma membrane. The entire structure is called motor and plate. It is covered by one or more Schwann cell in that insulates it from the surrounding fluids. Shows the injunction between a single axon terminal and the muscle fiber membrane. The invaginated muscle is called synaptic gutter or synaptic trough, and the space between the terminal and the fiber membrane is called the synaptic space and synaptic cleft, which is 20 to 30 nanometers in wide. At the bottom of the gutter are numerous smaller folds of the muscle membrane called subneural cleft, which greatly increase the surface area at which the sympathetic transmitter can act. In the axon terminal are many mitochondria that supply adenosine triphosphate, the energy source used for synthesis of a transmitter, acetylcholine, which excites the muscle fiber membrane. Acetylcholine is synthesized in the cytoplasm of the terminal but is absorbed rapidly into many small sympathetic nerve vesicles, about 300,000 of which are normally in the terminal of a single end plate. In the sympathetic space are large quantities of enzyme acetylcholinesterase, which destroys the acetylcholine a few milliseconds after its release from the sympathetic vessels. Secretion of acetylcholine by the nerve terminals. When a nerve impulse reaches the neuromuscular junction, about 125 vesicles of acetylcholine are released from the terminals into the synaptic space. From the detail of the mechanism can be seen in Figure 7-2, which shows an expanded view of a sympathetic space with the neural membrane above and the muscle membrane and its subneural cleft below. On the side surface of the neural membrane are linear dense bars shown in cross section in Figure 7-2. To each side of each dense bar are protein particles that penetrate the neural membrane. These are voltage-gated calcium channels, which an action potential spreads over the terminal. These channels open and allow calcium ions to diffuse from the synaptic space to the interior of the nerve terminal. The calcium ions in turn are believed to activate calcium 2 calmodulin dependent protein kinase, which in turn phosphorylate, phosphorylates synapsin proteins that anchor the acetylcholine vessels into the cytoskeleton of the presynaptic terminal. This process frees the acetylcholine vessels from the cytoskeleton and allows them to move to the active zone of the presynaptic neural membrane adjacent to the dense bar. The vesicle then dock at the release site, fuse with the neural membrane, and empty their acetylcholine into the synaptic space by the process of exocytosis. Although some of the aforementioned details are speculative, it is known that the effective stimulus for causing acetylcholine release from the vesicles is entry of calcium ions, and that acetylcholine from the vessels is then em- emptied through the neural membrane adjacent to the dense bar. Axon, myelin sheath, terminal nerve, muscle nuclei, teloglial cell, microfibrils, synaptic vesicle, axon terminal in synaptic through, subneural cleft. Figure 7.1. Different views of the motor end plate. A longitudinal section through the end plate. Surface view of the end plate. Electron micrograph appearance of the contact point between a single axon terminal and the muscle fiber membrane. The subneural cleft lying immediately below the dense bar areas which the acetylcholine is emptied into the synaptic space. The voltage gated sodium channels also line the subneural cleft. Excretory pulse of calcium ions. The normal resting state concentration 10 to the power minus 7 molar of calcium ion in the kysotol that bathes the myofibril is too little to elicit contraction. Therefore, the troponin-tropomyosin complex keeps the actin filaments inhibited and maintains a relaxed state of the muscle. Conversely, full excitation of the T-tubule and sarcoplasmic reticulum system causes enough release of calcium ions to increase the concentration of the myofibrillar fluid to as high as 2 to the power minus 4 molar concentration, a 500-fold increase, which is about 10 times the level required to cause maximum muscle contraction. Immediately, therefore, calcium pumps depletes the calcium ions again. The total duration of this calcium pulse in the usual skeletal muscle fiber lasts about 1/20th of a second, although it may last several times as long in some fibers and several times less in others. In a heart muscle, the calcium pulse lasts about 1/3 of a second because of the long duration of the cardiac action potential. During this calcium pulse, muscle contraction occurs. If the contraction is to continue without interrupting for long intervals, a series of calcium pulses must be initiated by a continuous series of repetitive action potentials as discussed in chapter 6. Malignant hyperthermia in susceptible individuals. Malignant hyperthermia and hypermetabolic crisis may be triggered by exposure to certain types of anesthetics, including halothane and isoflurane. or succinylcholine. Atlas 6 genetic mutations, especially of the ryanodine receptor or dihydropyridine receptor genes, have been shown to increase susceptibility greatly to develop malignant hyperthalassemia during anesthesia. Little is known about the specific mechanisms whereby anesthetics interact with these abnormal receptors to trigger malignant hyperthermia. It is known, however, that these mutations cause unregulated passage of calcium from the sarcoplasmic reticulum into the intracellular spaces, which in turn causes the muscle fiber to contract excessively. This, sus- this sustained muscle contractions greatly increase metabolic rate, generating large amounts of heat and causing cellular acidosis, as well as adaptation of energy stores. Symptoms of malignant include muscle rigidity, high fever, and rapid heart rate. Additional complications in several cases may include rapid breakdown of skeletal muscle, rhabdomyolysis, and a high plasma potassium level due to release of large amount of potassium from damaged muscle cell. Treatment of malignant hyperthermia generally involves rapid cooling of the administration of dantrolene, a drug that antagonizes ryanodine receptors, which inhibit calcium ions release for the sarcoplasmic reticulum and thereby attenuating muscle contraction. Figure 7.6 Excitation contraction coupling in skeletal muscle. The top panel shows an action potential in the transverse tubule that causes a conformational change in the voltage sensing dihydropyridine DHP receptors, opening the ryanodine RYR calcium 2 plus release channels in terminal cisternae of the sarcoplasm reticulum and permitting Ca2 plus to diffuse rapidly into the sarcoplasm and initiate muscle contraction. During repolarization, bottom panel, the conformational change in the DHP receptor closes the calcium 2 plus release channels and calcium 2 plus is transported from sarcoplasm into the sarcoplasmic reticulum by a adenosine triphosphate dependent calcium pump called SCRCA. Sarcoplasmic reticulum Ca2 plus ATP phase. Figure 7.7 Excitation contraction coupling in the muscle, showing 1. An action potential that causes release of calcium ions from the sarcoplasmic reticulum, and then 2. Reuptake of the calcium ions by a calcium pump ATP adenosine triphosphate. Chapter 8 Excitation and contraction of smooth muscle. Contraction of smooth muscle. Smooth muscle is composed of small fibers that are usually 1 to 5 micrometers in diameter and only 20 to 500 micrometers in length. In contrast, skeletal muscle fibers are as much as 30 times greater in diameter and hundreds of times as long. Many of the same principles of contraction apply to smooth muscle as to skeletal muscle. Most important, usually the same attractive forces between myosin and actin filaments cause contraction in smooth muscle as in skeletal muscle. But the internal physical arrangement of a smooth muscle fiber is different. Type of smooth muscle. The smooth muscle of each organ is distinctive from that of most other organs in several ways. Physical diminutions, organization into bundle or sheets, response to different types of stimuli, characteristics of innervation and function. Yet, for the sake of simplicity, smooth muscle is generally be divided into two major types, which is shown in Figure 8.1: multi-unit smooth muscle and unitary one single smooth muscle. Multi-unit smooth muscle.
Multi-unit smooth muscle. Multi-unit smooth muscle is composed of discrete, separate smooth muscle fibers. Each fiber operates independently of the others and often is innervated by a single nerve ending, as occurs for skeletal muscle fibers. Furthermore, the outer surface of these fibers, like those of skeletal muscle fibers, are covered by a thin layer of basement membrane-like substance, a mixture of the fine collagen and glycoprotein that helps insulate the separate fibers from one another. Important characteristic of multi-unit smooth muscle fibers are that each fiber can contract independently on the of the others, and their control is excreted mainly by the nerve signals. In contrast, a major share of control of unitary smooth muscle is excreted by a non-nervous stimuli. Some example of multi-unit smooth muscle are the clearly ciliary muscle of the eye, the iris muscle of the eye, and the pilorector muscle that cause the erection of the hairs when stimulated by the sympathetic nervous system. তারপর হচ্ছে urinary smooth muscle. Urinary smooth muscle is also called the synectial, synectial smooth muscle and visceral smooth muscle. Then the term unitary. The term unitary does not mean single muscle fibers. Instead, it means a mass of hundreds of thousands of smooth muscle fibers that contact together as a single unit. The fibers usually are arranged in sheets or bundles, and their cell membranes are adherent to one another at multiple points, so that force generated in one muscle fiber can be transmitted to the next. In addition, the cell membranes are joined by many gap junctions through which ions can flow freely from one muscle cells to the next, so that the action potential or ion flow without action potential can travel from one fiber to the next and cause the muscle fibers to contract together. This type of smooth muscle is also known as the syncytial syncytial smooth muscle because of its syncytial interconnections among fibers. It is also called the visceral smooth muscle because it is found in the walls of the most visceral of the body, including the gastrointestinal tract, bile ducts, uterus, ureters, and many blood vessels. The contractile mechanism of smooth muscle. Chemical basis of smooth muscle contraction. Smooth muscle contains both actin and myosin filaments, having the chemical characteristics similar to those of the action actin and myosin filaments in skeletal muscle. It does not contain the troponin complex that is required for the control of skeletal muscle contraction, and thus the mechanism for controlling contraction is different. This topic is discussed in more details later in this chapter. The chemical studies have shown that actin and myosin filaments derived from smooth muscle interact with each other in much the same way that they do in skeletal muscles. Furthermore, the contractile process is activated by calcium ions. Adenosine triphosphate is degraded to adenosine diphosphate to provide the energy for contraction. There are, however, major differences between the physical organization of smooth muscle and that of skeletal muscle, as well as difference in excitation, contraction, coupling, control of the contractile process by calcium ions, duration of contraction, and the amount of energy required for contraction. Physical basis of the smooth muscle. Smooth muscle does not have the physical basis of smooth muscle contraction. Smooth muscle does not have the same straight arrangement of actin and myosin filaments as in found in skeletal muscle. Instead, electron micrographic techniques suggest the physical organization shown in figure 8.2, which illustrate large number of actin filaments attached to dense bodies. Some of these bodies are attached to the cell membrane and others are disappear inside the cell. Some of the membrane dense bodies of adjacent cell are bonded together by intercellular protein bridge. It is mainly through these bonds that the force of contraction is transmitted from one cell to the next. In spared among the actin filaments is the muscle fiber or myosin filaments. These filaments have a diameter more than twice that of the actin filaments in electron microscope. In spared among the actin filaments in the muscle fiber are myosin filaments. These filaments have a diameter more than twice that of the actin filaments. In electron microscope, 5 to 10 times as many actin filaments as myosin filaments are usually found. To the right in figure 8.2 is a postulated structure of an individual contractile units in a smooth muscle cell, showing large number of actin filaments radiating from two dense bodies. The end of these filaments overlap a myosin filaments located midway between the dense bodies. This contractile unit is similar to the contractile unit of the skeletal muscle, but without the regularity of the skeletal muscle structure. In fact, the dense bodies of smooth muscle serve the same role as the jet discs in skeletal muscle. Another difference is that muscle of myosin filaments have the side polar cross bridge arranged so that the bridges on one side hence in one direction and those on the other side hinge in the opposite direction. This configuration allows the myosin to pull an actin filament in one direction. Physical structure of smooth muscle. The fiber of the upper left show actin filaments radiating from dense bodies. The fiber on the lower left and the right demonstrate the relation of myosin filaments to actin filaments. On the other side, while the simultaneous pulling another actin filaments in the opposite direction on the other side, the value of this organization is that it allows smooth muscle cells to
organ
organ
value of this organ
the value of this organization is that it allows smooth muscle cells to contract as much as 80% of their length instead of being limited to less than 30% as occurs in skeletal muscle. Comparison of smooth muscle contraction and skeletal muscle contraction. Although most skeletal muscle contract and relax rapidly, most smooth muscle contraction is prolonged tonic contraction, is sometimes lasting hours and even days. Therefore, it is be expected both the physical and chemical contraction of smooth muscle versus skeletal muscle contraction would differ. Some of the differences are noted in the following section. Show slow cycling of the myosin cross bridge, the rapidity of the cycling of the myosin cross bridge in smooth muscle, that is they are attached to actin the release from বাতাস ঢুকতে পারে না মনে হয়। তারপরে হচ্ছে কোথায় in much slower than the skeletal muscle. The frequency is a little as 1/10 to per 300, that is skeletal muscle. Yet the fraction of time that the cross bridge remain attached to the actin filaments, which is a major factor that determine the force of contraction, is believed to be greatly increased in smooth muscle. A possible reason for the slow cycling is that the cross bridge heads have far less ATPase activity than in skeletal muscle. That the degradation of the ATP that energized the movement of the cross-piece heads is greatly reduced, with corresponding slowing of rate of cycling. Low energy requirement of sustained smooth muscle contraction. Only 1 by 10 to 1 by 300 as much energy is required to sustain the same tension of the contraction in smooth muscle as in skeletal muscle. This too is believed to result from the slow attachment and detachment cycling of cross bridge, because only one molecule of ATP is required for each cycle, regardless of the duration. This low energy utilization by smooth muscle is important to the overall energy economy of the body, because organs such as the intestine, urinary bladder, gallbladder, and the viscera often maintain tonic muscle contraction almost indefinitely. Slowness of the onset of contraction and relaxation of the total smooth muscle tissue. A typical smooth muscle tissue begins to contract 50 to 100 milliseconds after it exceeds reached full contraction about 0.5 second and later. Then the declines the contractile force in another 1 to 2 seconds, giving a total contraction time of 1 to 3 seconds. This is about 30 times as long as a single contraction of the average skeletal muscle fiber. However, because there are so many types of smooth muscle contractions, some type can be as short as 0.2 second as long as 30 second. 0.2 second থেকে 30 second পর্যন্ত এটি ইউটেরাসের contraction. The slow onset of contraction of smooth muscle as well as its prolonged contraction is caused by the slowness of the detachment of the cross bridge with the actin filaments. In addition, the initiation of the contraction is response to calcium ions, each much slower than the skeletal muscle, as will be discussed later. Contraction is often greater in smooth muscle than in the skeletal muscle. Decreased contraction is often greater in smooth muscle than in skeletal muscle. Despite the relatively few myosin filaments in smooth muscle and despite the slow cycling time of cross bridge, the maximum force of contraction of smooth muscle is often greater than that of a skeletal muscle, as much as 4 to 6 kg per second centimeter square. Cross section area of the smooth muscle is comparison with 3 to 4 kilogram of skeletal muscle. This great force of smooth muscle contraction result from the prolonged period of attachment of the myosin cross bridge to the actin filaments. The latch mechanism of the facilitates prolonged holding of contraction of the smooth muscle. One smooth muscle has developed full contraction. The amount of the continuing excitation can easily be reduced to far less than the initial level, even though the muscle maintains its full force of contraction. Furthermore, the energy consumed to maintain the contraction is often minuscule, sometimes as little as 1 per 300 of the energy required for comparable sustainable skeletal muscle contraction. This mechanism is called the latch mechanism. The importance of the latch mechanism is that it can be maintained prolonged tonic contraction in smooth muscle for hours with the little use of energy. Little continued excitatory signal is required from the nerve fibers or hormonal source. Stress relaxation of smooth muscle. Another important characteristic of smooth muscle, especially the visceral urinary type of smooth muscle of many hollow organs, is its ability to return to nearly its original force of contraction seconds or minutes after it has been elongated or shortened. For example, a sudden increase in fluid volume in the bladder, thus stretching the smooth muscle in the bladder wall, causes an immediate large increase in pressure in the bladder. However, during about the next 15 to 60 seconds, despite continuing stress of the bladder wall, the pressure returns almost exactly back to the original level. Then, when the volume is increased by the another step, the same effects occurs again. Conversely, when the volume is suddenly decreased, the pressure falls drastically as fast, but it arises in another few seconds or minutes to or near the original level. These phenomena are called the stress relaxation, reverse stress relaxation. Their importance is that except for short periods, they allow a hollow organ to maintain about the same amount of pressure inside the lumen despite sustained large change in volume. Regulation or contraction by the calcium ion. As is rule for skeletal muscle, the initiating stimulus for smooth muscle contraction is an increase in intracellular calcium ions. This increase can be caused in different type of smooth muscle by nerve stimulation of smooth muscle fibers, hormonal stimulation, stress of the fibers, or even change in the chemical environment of fibers. Smooth muscle does not contain troponin, the regulatory protein that is activated by calcium ions to cause the skeletal muscle contraction. Instead, smooth muscle contraction is activated by an entirely different mechanism as described in the next section. এখানে একটা ছবি আছে membrane, physiology, nerve and muscle, extracellular fluid.
Figure 8.3. Intracellular calcium ion calcium 2 plus concentration increases when Ca2 plus enters the cell through calcium channels in the cell membrane or is released from the sarcoplasmic reticulum. The Ca2 plus binds to calmodulin to form calcium 2 plus CAMP complex, which then activates myosin light chain kinase. The active MLCK phosphorylates the myosin light chain, leading to attachment of the myosin head with the actin filament and contraction of the smooth muscle ADP, adenosine diphosphate ATP, adenosine triphosphate P phosphate. Calcium ions combined with calmodulin to cause activation of myosin kinase and phosphorylation of the myosin head. In the place of troponin, smooth muscle cells contain a large amount of another regulatory protein called calmodulin. Although this protein is similar to troponin, it is different in the manner in which it initiates contraction. Calmodulin initiates contraction by activating the myosin cross bridge. This active and subsequent contraction occurs in the following sequence. The calcium contraction in the cytosolic fluid of the smooth muscle increases as a result of the influx of calcium from the extracellular fluid through calcium channels and or release of calcium from the sarcoplasmic reticulum. The reticulum ion binds reversibly with calmodulin. The calmodulin calcium complex then joins with the activate myosin light chain kinase, a phosphorylating enzyme. One of the light chains of each myosin head, called the regulatory chain, becomes phosphorylated in response to myosin kinase. When this chain is not phosphorylated, the detachment, cycling of the myosin head with the actin filament does not occur. However, when the regulatory chain is phosphorylated, the head has the capability of binding repetitively with the actin filament and Proceeding through this entire cycle process of intermittent pulse, the same that occurs for skeletal muscle, thus causing muscle contraction. Source of calcium ion that cause contraction. Although the contractile process in smooth muscle as in skeletal muscle is activated by calcium ions, the source of the calcium ion differs. The important difference is that the sarcoplasmic reticulum, which provides virtually all the calcium ions for a skeletal muscle contraction, is only slightly developed in most smooth muscle. Instead, most of the calcium ions that cause contraction enter the muscle cell from the extracellular fluid at the time of the action potential or other stimulus. That is, the concentration of calcium ions in the extracellular fluid is greater than 10⁻³ molar in comparison with less than 10⁻⁷ molar inside the smooth muscle cell. This causes rapid diffusion of the calcium ion into the cell from the extracellular fluid when the calcium channels open. The time required for this diffusion to occur averages from 20 to 300 milliseconds, and it is called the latent period before contraction begins. This latent period is about 50 times as great for a smooth muscle as for a skeletal muscle contraction. Role of smooth muscle sarcoplasmic reticulum. Figure 8.4 shows a few slightly developed sarcoplasmic tubules that lie near the cell membrane in some larger smooth muscle cell. Small invaginations of the cell membrane called caveoli abut the surface of these tubules that lie near the cell membrane in some larger smooth muscle. Some invagination of the cell membrane called caveoli about the surface of these tubules. A caveoli suggests a rudimentary analog of transverse tubule system of a skeletal muscle. When an action potential is transmitted into the caveoli, this is believed to excite calcium ion release from the abutting sarcoplasmic tubules in the same way that action potential in skeletal muscle transverse tubes cause release of calcium ions from the skeletal muscle longitudinal sarcoplasmic tubules. In general, the more extensive the sarcoplasmic reticulum in the smooth muscle fiber, the more rapidly it contracts. Smooth muscle contraction is developed on extracellular calcium ion concentration. A calcium pump is required to cause smooth muscle relaxation. Myosin prophosphate is important in cessation of concentration. Possible mechanism for regulating the latch phenomenon. Figure 8.5 relaxation of smooth muscle occurs when the calcium ion concentration decreases below a critical level. Nervous and hormonal control of smooth muscle contraction. Nervous and hormonal control of smooth muscle contraction. Although skeletal muscle fibers are stimulated exclusively by the nervous system, smooth muscle can be stimulated to contract by nervous signals, hormonal stimulation, stretch of the muscle, and several other ways. The principal reason for the difference is that the smooth muscle membrane contains many types of receptor proteins that can initiate the contractile process. Still, other receptor proteins inhibit smooth muscle contraction, which is another difference from skeletal muscle. Therefore, in this section, we discuss nervous control of smooth muscle contraction, followed by hormonal contraction of other means of control. Neuromuscular contraction of smooth muscle. Physiologic anatomy of smooth muscle. Neuromuscular junctions. Neuromuscular junctions of the highly contracted type found on skeletal muscle fibers do not occur in smooth muscle. Instead, the automatic nerve fibers that innervate smooth muscle generally branch diffusely on the top of a sheet of muscle fibers, as shown on figure 8 to 6. In most cases, these fibers do not make direct contact with the smooth muscle fiber, called membranes, but instead of diffuse junctions that secrete their transmitter substance into the matrix, coating the smooth muscle often a few nanometers to a few micrometers from away from the muscle cells. The axons that innervate smooth muscle fiber do not have the typical branching end feet of the type found on motor and plate on skeletal muscle fiber. Instead, most of the fine terminal axons have multiple velocities distributed along the axis. At these points, the squamous cells then envelop the axons are interrupted so that transmitter substance can be secreted through the walls of the varicosities. In the varicosities are vesicles similar to those in the skeletal muscle and plate that contain transmitter substance. However, in contrast to the vesicle of skeletal muscle junctions, which always contain acetylcholine, these vesicles of the autonomic nerve fiber endings contain acetylcholine in some fibers and neuropinephrine in others, and occasionally other substances as well. In a few cases, particularly in the multi-unit type of smooth muscle, the varicosities are separated from the muscle cell membrane by as little as 20 to 30 nanometers, the same width as the synaptic cleft that is found in the skeletal muscle junction. These are called contact junctions, and they function in much the same way as the skeletal muscle neuromuscular junction. The rapidity of contraction of these smooth muscle fibers is considerably faster than that of fiber stimulated by the diffuse junctions. Excitatory and inhibitory transmitter substance secreted as at the smooth muscle neuromuscular junction. The most important transmitter substance secreted by the automatic nerve innervating smooth muscle are acetylcholine and norepinephrine, but they are never selected by the same nerve fiber. Acetylcholine is an excitatory transmitter substance for smooth muscle fibers in some organs, but an inhibitory substance smooth smooth muscles in other organs. When acetylcholine excites a muscle fiber, norepinephrine ordinarily inhibits it. Conversely, when acetylcholine inhibits a fiber, norepinephrine usually excites it. Why are these responses different? The answer is that both acetylcholine and norepinephrine excite or inhibit smooth muscle by first binding with a receptor protein on the surface of the muscle cell membrane. Some of the receptors protein are excitatory receptors, whereas there are inhibitory receptors. Thus, the type of receptors determine whether the smooth muscle is inhibited or excited, and also determine which of the two transmitters, acetylcholine or norepinephrine is effective in causing the excitation or inhibition. These receptors are discussed in more detail on chapter 61 in regard to function of the autonomic nervous system. Membrane potential and action potential is smooth muscle. Membrane potential in smooth muscle. The quantitative voltage of membrane potential of smooth muscle depends on the momentary condition of the muscle in the normal resting state. The intracellular potential is usually about -50 to -60 millivolts, which is about 30 millivolts less negative than in skeletal muscle. Action potential in unitary smooth muscle. Action potential occurs in unitary smooth muscle. For example, visceral muscle. In the same way they occur in skeletal muscle, they do not normally occur in most multi-unit types of smooth muscle in discussed in a subsequent section. The action potential of visceral smooth muscle occur in one of two terms: a spike potential or action potential with plateaus. Spike potential. Typical spike action potential, which as these seen in skeletal muscle occur in most types of unitary smooth muscle. The duration of this type of action potential is 10 to 50 milliseconds, as shown on figure 8 to 7a. Such action potential can be elicited in many ways, for example, by electrical stimulation, by an action of hormones on the smooth muscle, by the action of transmitter substance from nerve fiber, by stretch, or as a result of spontaneous generation in muscle fiber itself, as discussed subsequently. Action potential with plateaus. Figure 8 to 7c shows a smooth muscle action potential with a plateau. The onset of the action potential is similar to that of the typical spike potential. However, instead of rapid repolarization of the muscle fiber membrane, the polarization is delayed for several hundred to as much as 1000 milliseconds 1 second. The importance of the plateau is that it can account for the prolonged contraction that occur in some type of smooth muscle, such as the uterus under some conditions, and certain types of vascular smooth muscle. Also, this is the type of action potential seen in cardiac muscle fiber that have a prolonged period of contraction, as described in chapter 9 and 10. Calcium channels are important in generating the smooth muscle action potential. The smooth muscle cell membrane has far more voltage gated calcium chains than skeletal muscle, but few voltage gated sodium channels. Therefore, sodium does not participate much in the generation of the action potential in most smooth muscle. Instead, the flow of calcium ions to the interior of the fiber is mainly responsible for the action potential. The flow occurs in the same self-regenerative way as occurs for the sodium channels in nerve fibers and skeletal muscle fibers. However, the calcium channels open many times more slowly than sodium channels, and they also remain open much longer. These characteristics largely account for the prolonged plateau action potentials of some smooth muscle fibers. Another important feature of calcium ions entry into the cells during the action potential is that the calcium ions act directly on the smooth muscle contractile mechanism to cause contraction. Thus, the calcium performs two tasks at once. Action potential with plateaus. Figure 8.7c shows a smooth action potential with a plateau. The onset of action potential is similar to that of the typical spike potential. However, instead of rapid repolarization of the muscle fiber membrane, the repolarization is delayed for several hundred to as much as 1000 milliseconds. The uterus, under some conditions and certain types of vascular smooth muscle, also this is the type of action potential seen in cardiac muscle fiber that have a prolonged period of contraction, in discussed in chapter 9 and 10. Calcium channels are important in generating the smooth muscle action potential. The smooth muscle cell membrane has far more voltage gated calcium channels than skeletal muscle, but few voltage gated sodium channels. Therefore, sodium does not participate much in the generation of the action potential in most smooth muscle. Instead, the flow of calcium ions to the interior of the fiber is mainly responsible for the action potential. The flow occurs in the same self-regenerative way as occurs for the sodium channels in nerve fibers and skeletal muscle fibers. However, the sodium channels open many times more slowly than sodium channels, and they also remain open much longer. These characteristics largely account for the prolonged plateau action potentials of some smooth muscle fibers. Another important feature of calcium ion entry into the cell during the action potential is that the calcium ions act directly on the smooth muscle contractile mechanism to cause contraction. Thus, the calcium performs two tasks at once. Slow wave potentials in action in unitary smooth muscle can lead to a spontaneous generation of action potentials. Some smooth muscle is self-excitatory, that is, action potential arises within the smooth muscle cell without an excessive stimulus. The importance of slow waves is that when they are strong enough, they can initiate action potentials. Excitation of visceral smooth muscle by muscle stretch. When visceral unitary smooth muscle is stretched sufficiently, the spontaneous action potential are usually generated. Depolarization of muscle unit smooth muscle without action potentials. The smooth muscle fibers on multi-unit fiber smooth muscle, for example, the muscle of iris of eye or the pilorector muscle of each hair, normally contract mainly in response to nerve stimuli. The nerve endings secrete acetylcholine in the case of some multi-unit smooth muscle and norepinephrine in the case of others. Local tissue factors and hormones can cause smooth muscle contraction without action potential. Approximately half of all smooth muscle contraction is likely initiated by stimulatory factors acting directly on the smooth muscle contractile mechanism and without action potentials. Smooth muscle contraction in response to local tissue chemical factors. In chapter 17 we discuss control of a contraction of the arterioles, meta-arterioles and precapillary sphincters. Effects of hormones on smooth muscle contraction. Previously, lack of oxygen on local tissues causes smooth muscle relaxation and therefore vasodilation. Excess carbon dioxide causes vasodilation. Increased hydrogen ion concentration causes vasodilation. Fibers of hormone on smooth muscle contraction. Many circulation hormones in the blood affect smooth muscle contraction to some degree, and some have profound effect. Among the more important of these hormones are norepinephrine, epinephrine, angiotensin 2, endothelin, vasopressin, oxytocin, serotonin, and histamine. Mechanism of smooth muscle contraction on inhibition by hormones or local tissue factors. Some hormone receptors in smooth muscle membrane open sodium or calcium ion channels and depolarize the membrane. The same as after nerve stimulation, sometimes action potentials result or action potentials that are already occurring may be enhanced. In other cases, depolarization occurs without action potentials, and this depolarization allows the calcium ions to enter into the cell, which promotes the contraction. Smooth muscles have considerable diversity in how they initiate contraction and relaxation in response to different hormones, neurotransmitters, and other substances. In some cases, the same substances may cause either relaxation or contraction of smooth muscles in different locations. For example, neuropharine inhibits contraction of a smooth muscle in the intestine but stimulates contraction of smooth muscles in the blood vessels. Figure 7.1 Different views of motor and plate. A longitudinal section through the end plate. Surface view of the end plate. Electron micrograph appearance of the contact point between a single axon terminal and muscle fiber membrane. The subneural cleft lying immediately below the dense bar areas where the acetylcholine is emptied into the system aptic space. The voltage-gated sodium channels also line the subneural cleft. Each acetylcholine receptor is a protein complex that has a total number weight of approximately 275,000. The fatal acetylcholine receptor complex is composed of 5 subunit proteins, 2 alpha proteins, and 1 each of beta, delta, and gamma proteins. In the adult, an epsilon protein substitutes for the gamma protein in this receptor complex. These protein molecules penetrate all the way through the membrane, lying side by side in a circle to form a tubular channel. Illustrated on figure 7.3. The channel remains contracted as shown in part A of the figure until 2 acetylcholine molecules attack respectively to the 2 alpha subunit proteins. This attachment causes a conformation change that opens the channel, as shown in part B of the figure. The acetylcholine gated channel has a diameter of about 0.75 nanometer, which is large enough to allow the important positive ion, sodium, potassium, and calcium, to move easily through the opening. Patch clamp studies have shown that one of these channels, when opened by acetylcholine, can transmit 15,000 to 30,000 sodium ions in 1 millisecond. Conversely, negative ions such as a chloride ion do not pass through because of strong negative channels in the mouth of the channel that repel these negative ions. Figure 7.3 Acetylcholine gated channel. Closed gate. After acetylcholine has become attached and a conformation charge has opened the channel, allowing sodium ions to enter the muscle fiber and exit contraction. Note that negative changes at the channel mouth that prevent passage of negative ions such as chloride ions. In practice, far more sodium ions flow through the acetylcholine gated channel than any other ions for two reasons. First, there are only two positive ions present in large concentrations: sodium ions in the extracellular fluid and potassium ions in the intracellular fluid. Second, the negative potential of the side of the muscle membrane, -80 to -90 millivolts, pulls the positively charged sodium ion to the inside of the fiber while simultaneously preventing efflux of the positively charged potassium ion when they attempt to pass outward. As shown in figure 7.3b, the principal effect of opening the acetylcholine gated channel is to allow sodium ions to flow to the inside of the fiber, carrying positive charges with them. This action creates a local positive potential change inside the muscle fiber membrane. Also, the AND plate potential. This AND plate potential normally causes sufficient depolarization to open neighboring voltage gated sodium channels, allowing ever greater sodium ions inflow and initiating an action potential that spreads along the muscle membrane and causes muscle contraction. Destruction of the released acetylcholine by acetylcholinesterase. The acetylcholine, once released into the synaptic space, continues to activate acetylcholine receptors as long as the acetylcholine persists in the space. However, it is rapidly destroyed by the enzyme acetylcholinesterase.
To the spongy layer of fine connective tissue that fills the synaptic space between the parasynaptic nerve terminal and the postsynaptic muscle membrane. A small amount of acetylcholine diffuses out of synaptic space is then no longer available to act on the muscle fiber membrane. The short time that the acetylcholine remains in the synaptic space, a few milliseconds at most, normally is sufficient to excite the muscle fiber. Then the rapid removal of the acetylcholine prevents continued muscle re-excitation after the muscle fiber has recovered from its initial action potential. And plate potential or excitation of the skeletal muscle fiber. Sudden insurgence of sodium ions into the muscle fiber when the acetylcholine gated channels open cause the electric potential the inside the fiber at the local area of the end plate of the increase in the positive direction as much as the 50 to 75 millivolts, creating a local potential called the end plate potential. Recall from the chapter 5, then a sudden increase in nerve membrane potential of more than 20 to 30 millivolts is normally sufficient to incite more and more sodium channel opening, thus initiating an action potential at the muscle fiber membrane. Fibers in figure 7.4 illustrates an end plate potential initiating the action potential. The figure shows three separate end plate potential A and C are too weak to elicit an action potential, but they do produce weak local end plate voltage changes as recorded in the figure. By contrast, end plate potential B is much stronger and causes enough sodium channel to open so that the self-regenerative effect of more and more sodium ions falling to the interior of the fiber initiated an action potential. Self-regenerative effect of more and more sodium ions following to the interior to the fiber initiate an action potential. The weakness of the end plate potential at the point A was caused by the poisoning of the muscle fibers with curare, a drug that blocked the gating action of the acetylcholine and acetylcholine channels by competing for the acetylcholine receptor sites. The weakness of the end plate potential at point C result from the effect of the botulinum toxin, a bacterial poison that decreases the quantity of the acetylcholine released by the nerve terminals. Safety factor of transmission of the neuromuscular junction, fatigue of the junction. Ordinarily, each impulse that arrives from the neuromuscular junction causes about 3 times as much end plate potential as that required to stimulate the muscle fiber. Therefore, the normal neuromuscular junction is said to have a high safety factor. However, the stimulation of the nerve fiber at rates greater than 100 times per second for several minutes may diminish the number of the acetylcholine receptors so much that the impulse failed to pass into the muscle fiber. This stimulation is called the fatigue of the neuromuscular junction, and it is the same effect that caused the fatigue of in the central nervous system within. Synapses are overexcited. Under the normal functioning condition, the measurable figure of the neuromuscular junction occurs rarely and even then only at the more exhausted level of the muscle activity. Acetylcholine formation and release. Acetylcholine formation and release at the neuromuscular junction occur in the following stages. Small vesicles about 40 nanometers in size are formed by the Golgi apparatus in the cell body of the motoneuron in the spinal cord. These vesicles are then transported by the exoplasm and stream through the pair of axons from the central cell body in the spinal cord all the way to the neuromuscular junction at the tip of the peripheral nerve fibers. About 3000 of these small vehicles collect in the nerve terminals of the single skeletal muscle and plate. Acetylcholine is synthesized in the cytosol of the nerve fiber terminal, but it immediately acetylcholine synthesis in the cytosol of the nerve fiber terminal, but is immediately transported through the membranes of the vehicles to their interior, where it is stored in highly concentrated from about 10,000 molecules of the acetylcholine in each vehicles. When an action potential arrives at the nerve terminal, it opening many calcium channels in the membrane of the voltage-gated calcium channel. As a result, the calcium ion concentration inside the terminal membrane increases about 100-fold, which in turn increases the rate of fusion of the acetylcholine vehicles with the terminal membrane about 10,000-fold. This fusion makes many of the vehicle rupture, allowing the exocytosis of the acetylcholine into the synaptic space. About 125 vehicles actually rupture within each action potential. Then, after a few milliseconds, the acetylcholine is split by the cholinesterase into the acetate ion and choline, and the choline is actively reabsorbed into the natural terminal of the reused to form new acetylcholine. This sequence of events occur within a period of 5 to 10 milliseconds. The number of vehicles available in the nerve endings is insufficient to allow the transmission of only a few thousand nerve to muscle impulse. Therefore, for continued function of the neuromuscular junction, new vesicles need to be reformed rapidly. Within few seconds after each action potential is over, coated pits appear in the terminal nerve fiber membrane caused by the contractile proteins in the nerve endings, especially the protein calcarein, which is attached to the membrane in the areas of the original vehicles. Within about 20 seconds, the
Vesicles.
vesicles. Within about 20 seconds, the proteins contact and cause the pits to break away the interior of the membrane, thus forming new vehicles. Within another few seconds, acetylcholine is transported to the interior of these vesicles and they are then ready for a new cycle of acetylcholine release.
Drugs that enhance or block transmission of the neuromuscular junction. Drugs that stimulate the muscle fiber by acetylcholine-like action. Several compounds including methacholine, carbachol, and nicotine have nearly the same effect on the muscle fiber as acetylcholine. The main difference between these drugs and acetylcholine are that the drugs are not destroyed by cholinesterase or are destroyed so slowly that their action often persists for many minutes to several hours. The drugs work by causing localized areas of depolarization of the muscle fiber membrane at the motor and plate, where the acetylcholine receptors are located. Then, every time the muscle fiber recovers from a previous contraction, these depolarized areas, by virtue of leaking ions, initiate a new action potential, thereby causing a state of muscle spasm. Drugs that stimulate the neuromuscular junction by inactivating acetylcholinesterase. These particularly well-known drugs, neosigmine, physostigmine, and diopropylfluorophosphate, inactivate acetylcholinesterase the synapse synapse so that it no longer hydrolyzes acetylcholine. Therefore, with each successive nerve impulse, additional acetylcholine accumulates and stimulates the muscle fiber repetitively. The activity causes muscle spasm when even a few nerve impulses reach the muscle. Unfortunately, it can also cause death as a result of laryngeal spasm, which smothers a person. Neosigmine and physostigmine combine the acetylcholinesterase to inactivate the acetylcholinesterase for up to several hours. After which these drugs are displaced from the acetylcholinesterase so that the esterase once again becomes active. Conversely, the disopropyl fluorophosphate, which is powerful nerve gas poison, inactivates acetylcholinesterase for weeks, which makes this poison particularly lethal. Drugs that block transmission at the neuromuscular junction. A group of drugs known as curariform drugs can prevent the passage of impulses from the nerve endings into the muscle. For example, D-tubocurarine blocks the action of acetylcholine of the muscle fiber acetylcholine receptors, thus preventing sufficient increase in permeability of the muscle membrane channels to initiate an action potential. Myasthenia gravis causes muscle
Myasthenia
weakness.
gravis.
Myasthenia causes muscle weakness. Myasthenia gravis, which occurs in about 1 in every 20,000 persons, causes muscle weakness because of the inability of the neuromuscular junctions to transmit enough signals from the nerve fibers to the end of the fibers. Antibodies that attack the acetylcholine receptors have been demonstrated in the blood of most patients with myasthenia gravis. Therefore, myasthenia gravis is believed to be an autoimmune disease in which the patient have developed antibodies that block or destroy their own acetylcholine receptors at the postsynaptic neuromuscular junction, regardless of the cause. The end plate potential that occurs in the muscle fiber are mostly too weak to initiate opening of the voltage gated sodium channels, and muscle fiber depolarization does not occur. If the disease is intense enough, the patient may die of respiratory failure as a result of severe weakness of the respiratory muscles. The disease can easily be ameliorated for several hours by administering neosigmine or some other anticholinesterase drug, which allows larger than normal amount of acetylcholine to accumulate in the synaptic space. Within minutes, some of the effects can begin to function almost normally until a few doses of neostigmine is required a few hours later. Muscle action potential. Almost everything discussed on Chapter 5 regarding the initiation and conduction of action potential is nerve fibers appears equally to skeletal muscle fibers except for quantitative differences. Some of the quantitative aspects of muscle potential are as follows. The resting membrane potential is about -80 to -90 millivolts in skeletal fibers, about 20 to 30 millivolts more negative than neurons.
Real potential is the 5 milliseconds in skeletal muscle, about 5 times as long as in large myelin nerves. The Victory velocity of the conduction of 3 to 5 meters per second, about 1 by 13. The velocity of the conduction in the large myelinated nerve fibers that excite skeletal muscle. Action potential spread to the interior. The skeletal muscle fiber is so large, the action potential spreading along the surface membrane causes almost no current flow deep within the fiber. Maximal muscle contraction, however, requires the current to penetrate deeply into the muscle fiber to the vicinity of the separate myofibrils. The penetration to achieve by transmission of action potential along transverse tubules, T tubules. They penetrate all the skeletal muscle fiber is so large, the action potential spreading along its surface membrane causes almost no current flow deep within the fiber. Maximum muscle contraction, however, requires the current to penetrate deeply into the muscle fiber to the vicinity of the
Correct.
separate myofibrils. This penetration is achieved by
By transmission of action. This penetration is achieved by transmission of action potential along transverse tubules that penetrate all the way through the muscle fiber from one side of the fiber to the other, as illustrated on figure 7.5. The T-tubule action potential causes release of calcium ions inside the muscle fiber in the immediate vicinity of the myofibrils, and this calcium ion then cause contraction. The overall process is called excitation contraction coupling. Excitation contraction coupling. Transverse tubule sarcoplasmic reticulum system. Figure 7.5 shows myofibrils surrounded by tubule sarcoplasmic reticular system. The T tubules are small and run transverse to the myofibril. They begin at the cell membrane and penetrate all the way from one side to the muscle fiber to the opposite side, as shown in the figure. In these tubules branch among themselves and form the plate of T tubules, interlocking among all the separate myofibrils. Also, where the T tubules originate from the cell membrane, they are open to the exterior of the muscle fiber. Therefore, they communicate with the extracellular fluid surrounding the muscle fiber and contain extracellular fluid in their lumens. In other words, the T tubules are actually internal extensions of the cell membrane. Therefore, when an action potential spreads over a muscle fiber membrane, a potential change also spreads along the T tubules to the deep interior of the muscle fiber. The electrical current surrounding these T tubules are elicit the muscle contraction. Figure 7.5 also shows an sarcoplasmic reticulum in yellow. The sarcoplasmic reticulum is composed of two major parts: large chamber called intraminal intracellular cistern and about the T tubules, two long longitudinal tubules that surround all surfaces of contracting myofibrils. Release of calcium ion by sarcoplasmic reticulum. One of the special features of sarcoplasmic reticulum is that within its vascular tubules in an excess of calcium ions in high concentration. Many of these ions are related from each vesicle when an action potential occurs in the adjacent tubule. Figure 7.6 and 7.7 shows the action potential of the teat causes current flow into the sarcoplasmic reticulum cisternae, where they abut the T tubule. What is abut? Abut the T tubule. As the action potential reaches the T tubule, the voltage changes is sensed by dihydrophydralin receptors linked to calcium release channels, also called Raynaud receptor channels, in the adjacent sarcoplasmic reticulum cisternae. See figure 7.6.
The cisternae as well as their attached longitudinal tubules. These channels remains open for a few milliseconds, releasing calcium ions into the sarcoplasma surrounding the myofibrils and causing contraction, as described in chapter 6. Calcium pump removes calcium ions from the myofibrillar fluid after contraction occurs. Once the calcium ions have been released from the sarcoplasmic tubules and have diffused among the myofibrils, muscle contraction continues as long as the calcium ion concentration remains high. However, a contextually active calcium pump located in the walls of sarcoplasmic reticulum, myofibrils, Z এটা triad of the reticulum, H zone, M line, I zone, Z এটা এখানে হচ্ছে সার্কোলেমা, টার্মিনাল সিস্টার্নি, ট্রান্সভার্স টিউবুলি,
Mitochondrion.
সার্কোপ্লাজমিক রেটিকুলার ট্রান্সভার্স টিউবুল, sarcoplasmic reticular system. Note the tubules.
Sarcotubules.
Sarcotubules.